My relationship with food. I'm not ready to open up that can of worms.
I definitely am an emotional eater. I've experienced disordered eating.
I might pass on that.
My relationship to food is a complicated love-hate relationship or toxic.
I think emotional eating is really just, it's a form of a coping mechanism, you know?
Hi, I'm Dr. Jessica Yu. I'm a licensed clinical psychologist and senior director of patient experience at Hims & Hers. We all engage in emotional eating sometimes. It's not atypical or abnormal to reach for a piece of food, something that's delightful, after a stressful day. Emotional eating is a term we use to describe a specific type of eating behavior. It occurs when people use food as a response to their emotions, as opposed to as a way to satisfy their hunger. About 27% of Americans say that they eat in response to stress, and 34% of these individuals say that they do this as a habit. There are some great coping over the long-term skills. Consider problem solving. Once you detect patterns, you can determine what solutions are best for emotional eating. You can also do things like practice mindfulness and meditation. Mindfulness is the awareness of the present moment. It helps you slow down, and it'll also help you determine your feelings of hunger and satiety. Mindful eating is a great mindfulness practice. It'll help you really appreciate your food, taste it, delight in it, and slow down your eating as well. And there's always therapy. Cognitive behavioral therapy is an evidence-based psychotherapy that has been shown to be effective in the treatment of things like anxiety, depression, emotional eating, eating disorders, and more. Cognitive behavioral therapy really anchors on helping spot patterns in a person's behavior, patterns in the way they think, the way they feel, the way they behave, and solving those problems systematically. There's also a theory that people just have different innate eating patterns and eating behaviors. So some people might have anxious eating patterns, and they might be more prone to eating in times of anxiety and stress. We know that emotional eating has become a pattern if it starts to interfere with other areas of your life. Maybe you're spending more time eating or thinking about eating than actually doing work or engaging in work meetings or work tasks. Perhaps you're distracted while you're trying to get done with some homework or school tasks. Perhaps you're spending more time eating or avoiding eating, even in some instances, than spending time in your relationships. I would always recommend that if somebody is undergoing stress, and whether they engage in emotional eating or emotional non-eating, that they seek help if necessary. Again, there are some great therapies out there, cognitive behavioral therapy being the most evidence-based therapy for stress, anxiety, eating, so on and so forth.
Anyone that's experiencing like emotional eating and dealing with some of those issues, I would just let them know, to try to get to the root of their issue so that they can, really, I think, take hold of their feelings.